all about using the university's research to develop policy and practice for caring and connected and sustainable communities. Care Connect is one of the sector hubs that is part of the university's commitment to engaging with business, statutory organisations and the third sector to use our world-class research to inform policy and practice.
Care Connect is one of 14 innovation hubs in the university. Its overall aim is to connect research with policy and practice and to support the creation and sustainability of caring, connected communities. We bring together world-class research from across the university to both inform and explore the implications of policy and practice. We do this from a social, economic, health, legal and environmental perspective. We offer a range of support to the University of Leeds academics and researchers, as well as to our external partners. We offer an expertise matching service.
My name is Rachel Cooper. I'm the manager at Leeds Older People's Forum. We're a local charity that works with older people across Leeds. Recently we were developing a bid to the big lottery to tackle social isolation and loneliness in the city. And in leading on that bid, we put together a partnership of a range of organisations to help us to put in the application and to do all the work behind it. We hadn't worked with the university before, but we recruited Andrea Whitfield to the partnership. It was a very positive experience, so one of the things that the university was able to offer was a paid internship and 3 unpaid internships that we would be able to use in order to carry out the consultation work that we needed to do. Those interns enabled us to get out to more older people than we would have been able to do on our own, so it gave us extra capacity. They were able to get out to older people in their neighbourhoods and also on the weekend, which, as I say, we wouldn't have been able to do. So it gave those older people a voice in the bid. Ultimately, we were successful in our application to bring in 6 million into the city. The university played quite a big part in that, and we really hope that through working in partnership with the university that we were able to offer the interns an opportunity to gain skills and experience, and that Leeds Older People's Forum can contribute to the city much beyond just working with older people.
I'm Laura Conley. I'm a PhD researcher at the University of Leeds, and I recently took part in an internship with Care Connect. I was working on a project entitled Older People, Sex and Intimacy in Later Life, which really sought to kind of map existing knowledge and needs around intimacy in later life. And this really involved a kind of systematic search and review of the literature. Taking part in this internship and working with Care Connect was really valuable, not only in terms of enabling me to explore a new area, a new body of literature, but also in gaining some really important transferable skills around sort of organisation and communication.
We provide SeedCon funding for knowledge exchange.
Tila Sanders. I'm a reader in sociology in the School of Sociology and Social Policy at the University of Leeds. I've been involved with Care Connect on a number of different projects, but the most recent and the most important one in terms of my work has been having a small grant, which was a knowledge exchange grant. And this has enabled me and some key partners in the city to come together to put on a knowledge exchange event, which is sharing research findings which have been locally created through research projects to support one of the NGOs, Genesis, which is a sex work project in Leeds. The project has been working with the university in different ways for several years, and this has become our first learning event, learning knowledge exchange event, which we've brought together practitioners from all over the city, and it's also attracted national interest, so people are coming from different projects all over the country who work on the front line with sex workers in relation to safety, violence and support. We also have the chief national lead for prostitution come in, and we were given funding so we could bring in 2 keynote speakers with specific expertise to provide information about migrant sex work and male and trans sex work. So the money provided through the small grant has given us much needed resources and personnel in order to put on a very specific learning event for collaborators in the city, and also allowed us to think very specifically about the relationship between collaboration and disseminating research. One of the key benefits of Care Connect has been its very straightforward, non-bureaucratic processes and the ways that it's enabled researchers to work very quickly.
I'm Alison, and I've recently graduated from the University of Leeds and the Masters in Social and Public Policy. And during my MA, I was lucky enough to be involved as an intern on a project with Harrogate District Hospital, which was funded through Care Connect. The project was a collaborative partnership between the University of Leeds and Harrogate District Hospital. And as part of our involvement, we had to offer evaluative insight into the implementation of a new service. It was a liaison service for mental health patients in the Harrogate district area. As part of our involvement, we had to develop a logic map that mapped out the processes and the pathways that patients would navigate as part of the service. And it became clear that there's an extensive, complex array of various services involved, and that the success of the new service wouldn't work in isolation. It would depend on the services that already existed. We highlighted it as part of the report that was published at the end, that it was these connections between the wider services involved that really would underpin the success of the implementation of the service as a whole. So without Care Connect's funding for this project, that would have been acknowledged, so I think it was really important.
Hi, so my name is Pia Christensen, and I'm a professor in anthropology and childhood studies, and I'm in the School of Education here at the University of Leeds. I've been working sort of for about a year, I think, with Care Connect in relation to my research, and found it extremely beneficial in thinking about the impact of my work and the knowledge exchange and innovation possibilities of my work that I haven't thought about before. I was then contacted by Care Connect, and I thought, yeah, why not? This is interesting. I've been very much working around well-being and care in the past, but actually this possibility of creating new ways of thinking about care and thinking about how communities hold together, what is it that actually creates social coherence, family relationship and kid relationships within a community has been fantastic, really.
Promoting the development and sustainability of caring connected communities through capacity building.
My name's Julia Ellis, and I lead on the Primary Care and Community Reach programme at Carers Trust. As experts, Care Connect were the people we wanted to bring in to support us in actually doing some focus group training. We realise this is a really important area of work for us. We are there to support carers. It's important that we understand what carers' needs are, and we know that focus groups are a really good way of doing that. What we weren't confident about, though, was our own skills. We each have very different backgrounds, and there was quite a number of us who hadn't really had that kind of experience and training to confidently run a focus group. So we got in touch with Care Connect, and we explained that there's a number of us at Carers Trust who felt we would benefit from some focus group training. And they put together a course which was very much tailored to our needs and included lots of practical activities as well. So first of all, there was the theory, some really interesting information about the focus group methodology, the strengths and also the weaknesses of focus groups, and how to make sure that the group runs smoothly. And I think when it's an area that you've not had experience in, to have that kind of framework, to have some of the theory behind focus groups themselves is really useful. So on the day, we went through, as I mentioned before, focus group methodology, strengths and weaknesses. And then also how to plan the topics and look at the kinds of questions to ask, and also questions that we wouldn't be asking. We didn't want people to think that the focus group was anything other than an opportunity to answer the specific questions that we wanted to use. And so that gave us the confidence to then move on to the second part of the day, where we were actually running focus groups. It was really interesting. We were able to put into practice the theories that we'd covered at the first part of the day. And I think we all came away feeling really, really confident. It was a really, really useful day. And I know from talking to colleagues since then that they've all fed back to me personally that they found it was really, really helpful. So yeah, I think we've all moved on now to a point where we would feel pretty confident in setting up a focus group and running it successfully.
Hello, my name is David Hogg, Pro-Vice Chancellor for Research and Innovation here at the university. The city's Sustainable Society and Resilient Infrastructure theme brings together the university's cutting-edge work on the urban landscape. A remarkably diverse set of disciplines are involved, including earth and environment, engineering, transport studies, geography, economics, sociology, medical sciences and management. The conjunction at Leeds of a research community that embraces systems-based academic work that is engaged with external partners seeking viable, resilient and equitable societies provides an outstanding opportunity to pioneer transformative research on urban societies. Care Connect works in these areas and is very strongly positioned to support the university and its external partners. This will ensure that the work and world-class research undertaken at the University of Leeds has a positive impact on policy and practice supporting sustainable societies.